So, welcome to the Improving Hand Hygiene in Community Settings, session 1. So there are 2 sessions. This one is, I suppose, thinking about the evidence and looking from the evidence to the recommendations and then to action. There's a second session this afternoon, which we would encourage you to attend as well, which is also about the guidelines. But the starting point is much more research users. So who are the actors that are going to use the guidelines, and what are they going to do with that information? How are they going to implement these recommendations? What does that mean for national systems? So these 2 sessions are complementary. So 2 ends of the pipe, if you like. One starting with the evidence and looking in, and the other starting at the end of sort of demand and sort of government action. So please do come to the second one. There are 6 things we want to achieve today. First one is we'd like to achieve an introduction by Bruce Gordon. The second thing is we're going to have a really nice, concise presentation about the guideline development process. Yeah, quite complicated, quite rigorous and robust. So I think Joe's going to sort of open the lid on that. We then got Bethany Caruso from Emory University, who's going to give us a summary presentation of the 5 systematic reviews that were undertaken to retrieve and synthesize evidence that then went on to inform the guidelines. We then got a panel discussion with some leading experts in this sort of area, who are going to reflect a little bit on what the evidence said, how you go from an imperfect evidence base through to recommendations. We're then going to ask you all to do some work, some group discussions, feeding back, and then finally we're going to ask Sarah Roberts from the Reckitt Global Hygiene Institute to close with the last few reflections. Are you all in the right session? Good. Yeah. So I'm going to ask Bruce to come up and give your introductory remarks.
Yes. So we can achieve one thing at least, and I'm not sure. Ollie's put me to the test here, so good morning, everyone. I was actually thinking, this just came to me, which is maybe not a good thing to start with. My mom always said, think before you let your mouth go, and my mouth is going, but let's do a little quiz. So how many formal WHO guidelines on wash are there now? It's an easy one. You could just put your hands up. Oh no, actually let's do a vote. Yeah. So who votes for 1? Who votes for 2? Who votes for 3? Oh yeah, some of you voted twice actually, it's cool. That's what I do. There's 3. Okay, but that was an easy one. So, oh, Amy, you got that? I'm not even going to ask you. I'm not even going to ask you to name them, right? It's like, oh, jeez. But how many of those are actually compliant with the guidelines review committee process? 1. And it's this one, which is an amazing thing. And I'm sorry, because I'm giving a little bit of an introduction, like looking sort of inward at the sort of the WHO process, but one of the big changes, and it's very relevant to this session over the last years, probably a decade going on, is just this real drive toward having evidence-based recommendations. And this was in light of some guidelines that actually, let's just say, went south, where there were recommendations that were made and they caused some controversy. But in making this guidelines compliant, and you'll hear about it today from Joe, Bethany, and others, but that it was a huge undertaking. But it goes up on a little page on WHO, and it's like the guidelines page, and you won't see the guidelines for drinking water quality, and you won't see the guidelines on sanitation and health, even though they followed a process that was somewhat compliant. But the idea of going through these evidence to recommendations tables, a guideline development group, all those kind of things, those are very unique to this process. And I can tell you, I had a great time on the guideline, watching the guideline development group do its work. And there was a WHO steering group as well, representing regions and areas all over the world. But because there's so much that we could kind of get back from the science and sort of say, okay, well, that makes sense, Bethany, but what about this, this, and this? So I think there's a lot still to dig into, but I think there's a lot that we can take away, and I think we can be, this is more of a gratitude session for me, because I was feeling very grateful and thankful to everyone. And ultimately, I think the session this afternoon is something that we're also really excited about. The other thing I wanted to ask you about is has anyone seen the Semmelweis movie? No? You still haven't seen it. So I was at this Hungarian mission, and they love Semmelweis, and we love Semmelweis, and I know this is community settings, but there's like basically a Hollywood movie out there, and it's called Semmelweis. And it basically shows when you don't wash your hands, like bodies are coming out the back of the maternity ward, and it really is moving. And so I think that's really kind of why we're in it. And I guess my last point is, it's the governments that are going to make the change here. And our first recommendation is, policies, laws, regulations, an enabling environment, and that's so critically important. So we're really looking forward to working with all governments. And I think, we had some sessions. God, what were we talking about, Lindsay, yesterday? Help me out here. Sorry? No, what was our last session? It was on healthcare facilities.
What's next?
Yeah, what's next in healthcare? You're right. So they're asking all about these questions, and all he's just like, just shut up.
Not at all.
Sorry, I promise. But there's a lot of concern, like the post-COVID-19 piece, where people are, a little bit of flagging attentions, and like, how do we stay prepared? All these kind of things, and that's fundamentally here. I think why we're here is that we're wanting to patiently build, structures and systems over time so that we don't hear about the next pandemic. And I don't think that work is particularly, honestly, as attractive as doing emergency response, but it's critically needed. So I just wanted to thank all of you, really, it's just been a tremendous work. My director thought this was done in record time. I have a new boss, he's like, God, your team did this in record time. But I think it was only because Joe put the planning clearance in a week before she put the executive clearance in. So he thinks they were done in a week, but I think they just Anyway, sorry, Ollie. I don't know if that took the first accomplishment. Back to you.
Great. No, I think we overachieved. Really good. So our next speaker, Bruce, really good introduction to the guidelines and the guidelines process. Joe is World Health Organization WASH unit and has led the process of the guideline development of the. What are you coming over here? Yeah. So if you could tell us about your not somewhat compliant, but your compliant guideline process.
Thanks, Ollie. Yeah, fully compliant. So actually, just a slight tweak to what Ollie introduced. I will provide an overview of the development process, but and I'll indicate what we're going to be covering today in that process this morning, and what we're going to be covering this afternoon as well. So it'll be a bit split, and that hopefully will encourage you to attend both. Okay, that was the introduction. All right. So what I want to do actually is provide 5 or so slides of context for the guidelines. And Bruce has mentioned a bit of this already, and I'm pretty sure that I'd be preaching to the choir anyway, but I feel like it's an opportunity as well for you to come away with some knowledge, if you don't have it, around what reports are out there that can sort of substantiate that sort of value proposition for hand hygiene. So obviously we know that it's life-saving. We've known it since Semmelweis. What we're able to do now is actually quantify the burden of disease associated with poor hand hygiene, and we know that each year hundreds of thousands of people are dying from infections that could have been prevented with hand hygiene. So diarrheal disease, we know that we could reduce risk by 30%, and acute respiratory infections we could reduce risk by 17%. And there are a number of other health outcomes that we struggle to measure more precisely, but of course this is really an underestimate. We know it's cost effective as well, and so one study a few years ago put it on a par with oral rehydration therapy for children, although actually it's quite difficult to get good data on the cost effectiveness. We do know, of course, that it's a very cost effective intervention. We also know that there's global commitment to enabling the practice. The importance both to human development and to emergency response and health emergency preparedness is internationally recognised in the SDGs, but also in the more recent pandemic preparedness accord. And we also know that progress is lagging. And those of you who attended the JMP session earlier in the week will know this data already. But we have still 1.7 billion people lacking hand washing facilities with soap and water in their home. And we know that this is really focused in countries and areas where hand hygiene is needed the most. We also know that achieving universal access by our 2030 target would require a doubling globally, but really shockingly, I think, that rises to 11-fold in least developed countries and 8-fold in fragile contexts, which I think really shows that stark discrepancy. And finally, on my context slides, we know that guidance on how to accelerate has to date been unclear and lacking. And so we commissioned a scoping review around the time of COVID-19 when there was this demand for guidance from member states and demand for WHO guidelines. We carried out this review and we looked at 51 international guidelines, and we did uncover 923 recommendations on hand hygiene. But there was significant discordance, and there were a number of gaps that we identified as well. And I think quite shockingly, less than 10% of those recommendations were reported to be evidence-based. So we knew we had our work cut out for us. So what I'm going to show you now is what we did with this information and how we developed the guidelines that were published a couple of weeks ago. So WHO, as Bruce has mentioned, follows a very stringent, internationally recognised process for developing guidelines, which you can find in the Handbook for Guideline Development, if you have a week or so to read. And the process is here. So what we're going to cover today is the first two steps in this process, and Bethany in a minute will discuss the evidence assessment phase. The first phase is, I don't know if you can see it too well, but it's scoping, so making sure that we're really clear about the value add that these guidelines can provide in the broader landscape. So what questions can we answer, can we usefully provide evidence-based guidance on, and what's the scope of the work. So we did that, and I'll present a bit on that in a minute. Evidence assessment, taking those questions that we want to answer and seeing what answers the literature can provide for us, and then guidance formulation. We'll cover that in the next session, but essentially it's how do you take that evidence to guidance? Who do you rely on to do that, and what are the processes that make it rigorous? And then the published guidance. We'll also talk about, as Ollie said, how we can go to national policy adaptation, to implementation, and finally to impact in the session this afternoon. So in terms of the scoping phase, well, actually, let me just quickly highlight that as part of the process, we have these three independent groups that are working on the guidelines with us. And WHO is the steward and is coordinating this, but the idea is that we have these three groups that are really independent of each other. The first of which Bruce describes the steering committee. So we have WHO and UNICEF country and regional staff. We have global WASH staff from a number of different departments where hand hygiene is and should be relevant. And that steering committee was enabling the scoping phase, which I'll describe in a moment. Moving to the systematic review team, which was led by Emory University and by Bethany, who's with us here today, for their evidence retrieval, synthesis and assessment. And then we rely on the guideline development group to formulate recommendations. And here we have a number of those GDG members in the room with us today who can hopefully provide some reflections as well on the panel around how that process works, and we'll be covering that more in the afternoon. So just before I hand to Bethany, a quick note on the scoping piece. What we did, I mentioned already, and you can see that paper again here, that we did a scoping review of existing guidance. That gave us a pretty clear picture of where the gaps and where the discordance was. We took that then to end users and beneficiaries of the guidelines through multiple rounds of a consultative process, which culminated in May 2023 in The Hague with a consultation with a number of member states who were able to provide us with guidance on what they want to see in the guidelines, so really helping us prioritise those questions. And both of those processes are published in papers that you can see there, and I'll share a link to the home for all of these papers after the session. Finally then, what we did with the questions, so in fact let me present the questions for you and then hand over to Bethany on the systematic reviews. I find it useful to start with our theory of change, to sort of situate these questions within that. So very simply, we know that we ultimately want to achieve improved health outcomes. We know that sustained practice of effective hand hygiene can help us with that. We know that there are certain core requirements for hand hygiene without which the practice cannot be sustainably and effectively carried out. And we know that in order for the core requirements to be available to everyone, we need to have a strong system for effective service delivery. So the key questions that came out of our scoping phase that people were interested in understanding more about, in line with those blocks, were what is effective hand hygiene exactly? So specifically, how best to practice it, around questions around technique, when to practice it, so do we have the key moments right, and with what materials in different contexts and different settings. The second question was around what are the minimum material requirements for the practice of hand hygiene, and then looking more on the behavioural side, what are influential behavioural factors and how can interventions leverage those behavioural factors. And finally, we wanted to understand specifically what the role of government is in ensuring a strong system for effective service delivery. So what are those government measures that can really be system strengthening? The systematic reviews, then you can see there on the right, there are 5. Each of them cover these questions, and that's what Bethany's going to present today. And so I'll pass on to you.
Great. Well, thanks everybody. Thanks for the introduction and thank you for being here. So I'm going to give a pretty brief overview of the approach. These are 5 systematic reviews and methods are really, really intense. But I just want to give you a brief overview so that you understand our process for managing these 5 reviews. As all of them were focused on hand hygiene in community settings, what we decided to do was start with a first phase of searches where we reviewed titles and abstracts specifically looking for hand hygiene studies in community settings. And what this did is allowed us to have a reduced sample of studies that were focused on hand hygiene in community settings. That became our new pool, for which we then had more bespoke search review criteria to answer the 5 areas and questions that Joe was talking about around effective hand hygiene, minimum requirements, behavior change, and also government measures. Now, I just want to also clarify that these systematic reviews did not actually just answer 5 questions, but before I do, I'll just sort of emphasize that after all of the double screening and reviews and stuff, we basically went through a ton of literature here. And so I mentioned these numbers just to give you all some confidence in the fact that we were pretty exhaustive. And so we feel really confident in what we know and what we know that we don't know as well. So while these are the 5 buckets of questions, we actually had sub-questions within these. So to give an example, for effective behavior change, the main overarching umbrella question was, which hand hygiene methods are effective at removing or deactivating pathogens? Now, one of the sub-questions, though, was, how effective are soap products specifically at removing or deactivating key pathogens? I'm not going to go through all of the questions we had, but we did have very specific eligibility criteria for each of these questions and which papers were included to answer these questions. And just to note that actually overall, we didn't have 5 questions, we had 5 reviews. We had 22 questions that we were answering in order to inform the guidelines. There's a lot of information in these papers, so I encourage you to go there. There's no way in the next 15 minutes that we're going to cover all 22 questions, so I'm just going to focus on a little bit. Starting with the first review, this focused on which hand hygiene methods are effective at removing or deactivating pathogens associated with disease transmission by hands in community settings. We had 177 papers that informed this. About the same proportion of studies focused on alcohol-based hand rub as did on soap and water. 67% reported on the efficacy for bacteria, 7 on viruses, 4 on enveloped viruses. If you add all that up, you're like, where's the rest? Some studies are not very good at specifying what they're doing. We learned that through this research as well. We also found that 90% of the studies focused on lab testing that was trying to understand interventions that are community settings appropriate, which is why they qualified to be included in our review. So they usually involved experimenting on contaminated hands and computing log reduction values. So just to orient you to this slide real quickly before I fill it with a bunch of numbers. So I'm going to show you just numbers for bacteria and viruses, for soap and water, alcohol-based hand rub, and also other antiseptics. And so you have an awareness of what to look at for these numbers. For efficacy, a log reduction value over 2 is commonly accepted as a target. So the higher the number, the better. So looking first at soap and water, we see that soap and water perform well for both bacteria and viruses. And for ABHR and other antiseptics, for bacteria, those numbers are higher than 2. But they're floating under 2 for viruses, for ABHR and other antiseptics. So there's a sort of need here that shows that it doesn't appear to be as effective, but with the caveat that we didn't have as many studies, as I showed you on the previous slide, on, for example, non-enveloped viruses. And these are likely to respond very differently and account for most emerging viral diseases. Something to keep in mind. So a key takeaway from this in terms of next steps is that more evidence is needed for non-enveloped viruses. For this paper, we also sought to understand more about hand drying methods, soap alternatives, and washing with contaminated water, and we had very limited evidence to answer those questions. Number 2, so what were the minimum requirements, material needs for the sustained practice of effective hand hygiene in community settings, for which we had 37 studies. So what do we mean by minimum requirements? For this, we were specifically looking at quantity of water, quantity of soap, location of hygiene materials, number of users and spacing, and equitable access. Most of these studies, which is actually different from some of the other papers in the reviews, were from the Americas or Europe. They mostly were more in households than in institutions or public settings. And only 32% of the studies included actually looked at the relationship between material requirements and hygiene. So limited information there. Also, we found data on the presence of hand washing facilities being really important, but not really specifically on the location. So we're really limited in answering that part. Similarly, we found data on the presence of soap and the presence of water, but not on the quantity of soap or water. So that's a real limitation of some of what we're able to say on those specific questions. That being said, we know from EPI studies that there is a link between water scarcity and health impact of hygiene interventions. So that informs our understanding going forward. And also that households have many competing tasks for water in their household, many competing tasks for soap in their household. So we have to consider what and how we can get better estimates of how much soap and water are actually needed and critical to better inform people. So specifically, more evidence is needed around these specific quantities, these relationships, these minimum material requirements, locations, and also between the relationship between the material requirements and hand hygiene practices. The third study looked at what the key behavioral barriers and facilitators are to practicing effective hand hygiene. This was specific to qualitative research studies. We felt it was really important to understand specifically from users in each of these areas what they discussed as the barriers and enablers to their hand hygiene environments, instead of quantitative studies, which might have sort of been biased from the outset of imposing sort of researcher views of what they were measuring. Most of these studies were in Africa or Southeast Asia. Most of them focused on domestic settings, and most of them focused on hand washing with soap and water. In order to answer this question, we use the CALM-B framework. Some of you may be familiar with this. So CALM, capability, motivation, opportunity. Really briefly, physical capability is your physical actual ability to wash your hands. Your psychological capability is that you know how to do it. Reflective motivation is when you think of something, you're motivated to do that thing. Automatic motivation, you don't think about it, but you do that thing. Opportunity, physical opportunity, when something's there, you use it. Like here, there's snacks, you eat them. Social opportunity, your environment, people around you encourage that behavior. So like here, everybody's gonna have snacks, you're gonna have snacks after this. So all of these influence your behavior. What we found, by and large, is that the biggest barrier that people talked about is that I just don't have soap, soap is too expensive, and I don't have the water to actually do this practice. It feels a little bit like a no-brainer, but people are voicing it, and it's a true barrier. Reflective motivation was also a barrier. This is really around time prioritization. When thinking about it, people just didn't have the time to do the work compared to everything else that they were doing. And also they would say, I don't have the habit. I don't have the internal motivation. Thinking about facilitators, people talked about health risk. They were motivated by an acute health risk. And in terms of automatic motivation, people said, I do have a habit. So when it was there, they practiced it. When it wasn't, they weren't. In general, we found that we need more evidence from regions outside of Africa and Southeast Asia along the barriers and enablers of hand hygiene. We also don't have many studies that are specific to ABHR or other soap alternatives, and very little in comparison, focusing on public and institutional settings compared to the domestic setting. The fourth review focused on intervention. So the question here is, among interventions to improve hand hygiene in community settings, what theories, barriers and enablers, intervention functions, behavior change techniques, and design features have been leveraged effectively to improve and sustain hand hygiene in community settings? There are a lot of sub-questions here. It is really thorough. I'm not going to go through all of those, but to give you some key takeaways. The first is, as is consistent with the other qualitative work, most of the work is done in Southeast Asia and Africa regions. Very few actually focused on public settings, only 4%, compared to domestic and institutional settings. And 64% focused on hand washing with soap and water, at 9% on ABHR, but I really want to say and just highlight that 28% of these intervention studies did not actually specify with clarity what the hand hygiene behavior was that they were investigating. We also used CONB here to organize some of our findings. But here's the key learning. First, 82% of all the interventions that we looked at reported to be effective. But we weren't able to actually look across these studies because there was such intense variability on what the reported outcomes were, if they actually specified them, what their interventions included, and their different settings and populations that were targeted. There was also a lack of alignment between the barriers and enablers reported and what interventions actually addressed. So for example, action knowledge. Action knowledge is, you're giving somebody the ability to know what to do in terms of when to wash their hands, how to wash their hands. It was talked about as a barrier or an enabler in 38 studies, but actually people provided interventions for that in 190. So what does that mean? This lack of alignment can be wasteful, actually. If you're doing something that doesn't need to be done, that's a waste of time and resources. It can also be limiting in effectiveness if you have a barrier or enabler that you're not acting on. Also, barriers and enablers that have been often intervened on are not those that have been identified as critical. So in terms of the sum of what we saw that was intervened on, there was a mismatch between what we found in the other review and in other reviews in terms of the biggest barriers. So I talked about before, soap, access to water, soap, the implements to wash your hands were considered barriers for people, but most of the interventions did not actually provide these necessary requirements. They did not provide any resources to enhance the environments to enable people to actually wash their hands. So in terms of key learning from this review, first we need better reporting on interventions. In terms of the evaluations themselves, we need greater specificity on outcomes. For example, you need to indicate what you're studying. And interventions also need greater detail on what they actually did and why, with justification of why they actually did what they did. And in general, in terms of more evidence, more outside of Africa and Southeast Asia. We need evidence specific to ABHR and SOAP alternatives. We need evidence in public settings, especially as we sort of think about our lessons learned from COVID and interacting in public settings and in institutional settings, but specifically non-school institutional settings. And we didn't find barely any studies that engaged people with disability. So the final one here, what government measures have been implemented to support minimum requirements, water and soap, for equitable and sustained practice of effective hygiene in community settings? And there were 31 studies in this. This is review 5, not number 4, didn't stick there. So what we did is, you might all be familiar with the sanitation and water for all building blocks. These 5 building blocks were used as a means to categorize government measures. So 75 government measures were identified across these 31 studies. And so we created an evidence map. And predominant focus on these government measures was in domestic settings. And most of them focused on capacity development and sector and policy strategy. Now, comparatively, there was actually very little that we found related to sector financing interventions. So thinking about what these interventions were, what these government measures were, in terms of their evaluations, 17 out of the 31, 55% had a sort of positive impact of these government measures that were taken. And of these 17, they represent all the building blocks. So there's some learning that we can have across all the building blocks. Now, importantly, again, among these 45, only 4 of those 45 measures explicitly assessed or reported on sustainability. So we have very limited evidence on the sustainability of these government measures. So some key takeaways on this. We have some mixed evidence around government measures, reflecting some inconsistent reporting, reflecting challenges evaluating some really complex government interventions. And so moving forward, there's a need for more evidence specifically around public spaces, given that so much was more on domestic and institutional settings across the regions, and also related to sustainability. So that is the brief overview, the rapid review, but just to point out, this was a very extensive team that was reviewing all of this, and just a special shout out also to Matthew Freeman and Marlene Wolf, who co-led around some of these, and also our superstar Jed Snyder, who was engaged in all of it from start to finish. And with that, I'm going to hand it back over to Ollie.
Both Joanna and Beth, I was amazed how you managed to cover all of that ground in short presentations, because I mean, it literally is sort of 4 years work, and each of those 5 systematic reviews in and of themselves is a huge amount of work. So the links are in the slides. You can contact Bethany or Joanna, and we can share those if you do want to read the reviews, which I would recommend. The next bit of the session, we've invited some experts to sort of comment, have a quick discussion about the guidelines. So could I just ask Amy, Robert and Kondwani, could you please come to the front? Okay, yeah, you choose where you'd like to. So I think, Bethany, at the beginning of your presentation, you said you feel fairly confident that you and the team now know what we do know, but you also know what we don't know. And you know, there were as many gaps, I think, as there were sort of fillers in this exercise. But ultimately, WHO has to do that difficult job of going from whatever evidence exists to making sensible recommendations. And that jump from an imperfect evidence base through to sensible, heuristic, pragmatic recommendations is quite difficult. So we thought we'd invite Amy, Robert and Kondwani as researchers in this area, but also people who were involved in the process, some of those independent groups that Joanne talked about, to reflect a little bit on this difficult business, which often happens in environmental health. The evidence base is not perfect, but we do want governments to act. So I'm going to start with Amy, and if you'll forgive me, I'm going to characterise you as an epidemiologist who does quite a lot of microbiology. Is that fair? Yeah. So maybe you'd like to sort of think a little bit about that evidence base and how you go from imperfection to good enough recommendations.
Yeah. So first of all, I just want to say this was my first experience being on one of these guideline development groups, and I really enjoyed the process. I'm not sure if this is on. You can hear me. Yeah. Despite the fact
the
that
people online won't
Oh,
be
okay.
sorry.
Yeah, despite the fact that it was 1 a.m. to 8 a.m. for me in California for the sessions, despite that, I still really enjoyed the process, and it was really nice to have a diversity of perspectives on the group as we put together these guidelines. So with respect to considering evidence gaps and trying to come up with guidelines, I think that two components are really, really critical. So when you have an evidence gap, I think you turn towards risk, like assessing risk, as well as feasibility. So I'll give one example. One of the lack of evidence that we had was the time for hand washing with soap, and if it really makes a difference if you're hand washing for 60 seconds versus 30 seconds. And there was just not very much evidence on that. And so what the guideline group decided to do was to recommend a really practical, feasible approach of telling people, cover your hands completely with soap or cover your hands completely with alcohol-based hand sanitizer. And that's really going to be the most important thing to remove pathogens from your hands. So that's one example. And then I think with respect to risk, I'll pull another example of a lot of hand hygiene agents have added antimicrobials in them, and so there is good evidence that the hand hygiene agents, when the antimicrobials are just like similarly effective to hand hygiene agents without antimicrobials. So the recommendations are to use plain soap or alcohol-based hand sanitizer because those are just as effective as soap with added things like triclosan and quox. And where risk comes in is that those compounds actually lead to antimicrobial resistance of bacteria. So there's lots of lab studies that have shown that when those agents are added, bacteria develop resistance, and that leads to the burden of AMR in the world. And so I think that was kind of some adjacent literature that helped, like the experts knew, that literature, and so that was helpful for developing these guidelines. So I'll stop there and can hear from the other panelists.
Amy, I should have said from Berkeley University, but again, nothing which amazed me in this process was
University of California, Berkeley.
University of California.
Let's the Europeans, we need to learn,
Yeah. That's good learning. Lots of learning. Yeah. This process is all about learning. But yeah, just to acknowledge, I have to say, Amy was one of the most present members of the guideline development group, despite the
even
fact,
though it was the middle of the night,
even though it was 1 o'clock in the morning. So yeah, thank you, Amy.
But all restraint was gone because I was so tired.
Yeah, you're very frank. Very frank. Robert, also an exemplary attendee of the guideline development meetings. So if Amy is an epidemiologist who does a lot of microbiology, I'm going to characterize you as a behavioral scientist who does quite a lot of epidemiology. So maybe if you cared, you could engage in this question, think about the behavioral science.
Yeah, no, thanks. And that, as we saw with the reviews, kind of behavioral science, hand washing is by default to behavioral intervention, and knowing this is very central. And as someone who's worked in this space for a while now, one of the questions we always get is, it tends to be about theory. So which theory is best? Which theory works for hand washing? There's so many different models out there. Should we be using BCD? Should we be using RANAS, IBM Wash, COM-B? Take your pick. And you know, particularly around that kind of, you know, it wasn't part of the slides, but the evidence really isn't available to say this theory works better than this theory. The evidence isn't even really available that theory works better than non-theory, but then sitting back and realizing, well, maybe that's not really the question here. Maybe it's just, you know, it's not necessarily theory versus non-theory, but using an organized approach versus a non-organized approach, but how do you actually measure that? And I think kind of building off what Amy said about this kind of, you know, focusing on the feasibility, there's also a level of pragmatism that I was very, you know, I started this meeting, it was midday for me, so I was fully prepared to sit back and have arguments with a bunch of people about various theories. But, you know, the pragmatic approach that kind of emerged as a consensus within the global guideline commit, the GDG, whatever we stood for, of just use anything, just use something, just find a way to organize what you're doing. Have a structured approach here rather than trying to kind of focus on a primacy. And I think that carries over from the microbiology, you know, understanding what's the pragmatic approach that we can take here? How can we kind of solve something with imperfect evidence? How can we do the best possible? And I think that's really reflected in both not just, you know, recognizing there are evidence gaps, but we can make some key assumptions on what's still the best way forward with this. So, yeah, stop there.
I should have said Robert is from the London School of Hygiene and Tropical Medicine, which is in London. Right, Kondwani.
Yeah.
I don't know how to characterise you. What I'm going to say is, Kondwani, he's the director of an institute called WashTED, which is sort of technology engineering, but you yourself have done lots of like epidemiology, microbiology, behavioural science. The other thing which is, I think, sort of maybe notable in your work is around sort of public settings. So I think of, you've done lots of work around, for example, food hygiene. You've also done lots of work in, for example, guardian waiting shelters, this sort of things, so different types of settings. So maybe, Kondwani, you could sort of reflect out to Amy and Robert, sort of what you took from this process and how you made good recommendations.
Yeah, thanks very much. I think participating in this process, to me, I think it was also the first time, and it was really a very good experience to be a member of the GDG. I should say that I will mainly talk about the context, especially in the local settings, and with the recommendations that have been made. So I will give an example of the location for the hand washing facilities, for example. If you go into the guidelines, the GTG and other team members, we haven't been specific enough to mention, to say maybe close to the kitchen or whatever, but it's a bit general because there's still some gap, the evidence to say we should mention these specific locations may not sound better, but rather we should just say it in general to say any location linked to key times for hand washing, a location that will enable someone to perform hand washing at those critical times. And that's being clever enough, because we're not giving people a chance to run away from hand washing in those critical times. So I think that is really quite a good way to go, while we're still looking for more evidence in terms of the location. But also the issue of, I remember during the processes, there was the issue of use of ash as a material for hand washing. It sparked a lot of debate among the GTG members, but there was also evidence from the scoping, from the systematic reviews showing that ash could be effective in hand washing. But then the issue of risk as well, as it has been mentioned, should we really go for ash? Looking at the settings like, for example, in Malawi, would that really work? Would that really help to address the problem? So if you go through the recommendations, you see that ash has been dropped off as among the key materials that should be there in terms of hand hygiene, which is quite important. And I think for that particular aspect, it should be highly stressed when we are talking to the governments to say that these have been made because of ABCD. So I think we as researchers, we still have a lot of work, especially showing the evidence from the systematic review. Why have we arrived at these recommendations? It's quite important. Otherwise, if we don't make it clear, the government officials will not take it because they wouldn't understand. Why have we come up with this? But also we are talking of these as international guidelines. We have to contextualize these guidelines. So researchers have a lot to play. How can we take these recommendations into our own local policies and the national guidelines that we have? How are we accommodating all this? I think it's quite important. Otherwise, we may end up missing some of the key points that are required. Thanks, Gordon.
Thanks, Kondwani. I think, sort of listening to each of the panellists, you've given really nice examples of where specific points where maybe going into the guideline process, people had sort of prior assumptions or beliefs, whether it's about sort of using ash as a sort of safe hand washing sort of material, whether it's, is it 20 seconds or is it 60 seconds for washing your hands, or we absolutely have to use sort of behaviour change theory. And looking at the evidence, it's more nuanced and complicated, but for each of those, I feel that sort of sensible, practical guidance was arrived at. So in sort of Amy's sort of case, fixate less on 40 seconds or 60 seconds. What are the steps that have to be sort of followed for us to be reasonably confident that you're practicing safe hand hygiene? Maybe get less fixated on which particular behavioural change theory it is, and let's talk about sort of organised, systematic approaches to designing hand hygiene programmes. And then, Kondwani, what I liked in your example was going from this specific issue, which is very pertinent in the Malawi context, to now not just looking at the evidence base, making recommendations around whether it's safe or not, but then going the next step to engage with policymakers and governments in a country like Malawi where ashes may be considered safe, to explain why that recommendation has been made, to share the evidence. And if the evidence is just lacking, if it's we don't know, then to use that as a basis for investing in sort of future research that might answer that question, which is important to the government of Malawi. But good news, Bethany, who's in charge and pulling the strings, I think she liked your first round of responses, engaging and fun. So you passed to the second stage. You get a second question. And the second question is, for each of you, and you're only allowed one, there are all of these interesting research questions, these gaps that we could sort of go at if we had resources to do so. For each of you, being part of this process, what do you think is the research question that you either feel is most important, or that you as an individual researcher think, I'd like to have a run at plugging that gap? Amy, we go to you first.
Oh, so many research questions. But can I just also make one more comment on this evidence risk and guideline development process, and with respect to the ASH decision, because I think it's also really important that through the process you're thinking through, okay, here's the evidence, here's a potential guideline, how is this actually going to be implemented, and what are the risks for making this recommendation? And I think one of the issues with the ash and sand and soil is, like, yes, there's a little bit of evidence that it could be effective at inactivate or removing bacteria from hands, but what hasn't been investigated is the risks. So, like, are there toxic chemicals in ash, and what's the implications of that? What's actually in ash, and should that really be put on hands? Because at the end of the day, what we're trying to do is reduce the infectious dose that someone ingests from contaminated hands, and so we want to bring down that infectious dose, but we don't want to add risks during that process. So back to what would be really important research studies going forward. I think one could be to investigate the risks of using ash and sand and soil. Because it was so controversial, I feel like a little bit more evidence around the risks around using those agents for hand hygiene would be useful. And then I think another, since I'm a microbiologist, I think another really interesting question is hand drying. And there wasn't a whole lot of evidence on hand drying methods, like should you use a towel, should you air dry, how long do you have to air dry? And so I think a lot of people end up air drying, but there's not a ton of evidence of how effective that is. That would be fine.
Great, thank you. Robert, would you like to get in?
Sure. I think for me, just kind of thinking through, you know, the questions that often kind of come up around some of these things. I think a lot of it comes down to those minimum requirements and what we actually need to enable effective hand hygiene. Those are the questions that, you know, I'm thinking about experience during COVID-19. What do we do in a water scarce environment? How much water do we need? Do work in schools, you know, how much soap do we actually need to budget for this institution? We're doing our annual budgets now. What do we need to buy? Where do we need to put the hand washing stations to enable that behavior? So not one question, but within those reviews, an entire family of questions about what do we really need from the material perspective to enable this really critical behavior. And I think there's a lot left there. We saw the evidence on a lot of those things, pretty limited, and there's a lot we can do to kind of explore that more.
Great.
Yeah, I think for me, I would have two areas. The first one is looking at the duration for sufficient hand washing. I think we did not provide the specific time, but there is still a statement that encourages members to wash hands for a sufficient period of time. So I know that in the context of the local settings, there is a saying that some people believe that effective hand washing is associated with 20 seconds, okay? But for these guidelines, we haven't specified the time. So that will create a debate to say, which one should we go for? Much as these ones are talking about sufficient time, and then these other guidelines or other items are saying 20 seconds. So I think we need more evidence on that one so that we are confident enough to say maybe we should go for this. That's the first element. The second element is to do with the amount of soap required. I think we haven't really finished on that one. More evidence is required. For sufficient hand washing, how the amount of soap, the quantity of soap required for one round of hand washing, how much should that be? Because if we know, then we should be able to even to project if we have this amount, if we have this number of people in a given area, then it may also help us to entail the quantities of soap required for this group of people. So I think those are some of the areas that require further exploration.
Great, thank you all of you for your single recommendation. So Kondani, you did do two. Which is fine. I think the second one is really useful, and it might be something that gets picked up this afternoon as well, because you can think about that question at the level of what are you telling individuals? You know, how much do you as an individual need in terms of the quantity? So it's also really important if you zoom out to policy and you think, what do we need to achieve at systems level to make sure that every individual within a population has access to that sufficient quantity of soap? And when you multiply the individual needs by a population, that raises really challenging questions at a policy level, because you have to make sure that, you know, whether it's through direct provision through the government or whether it's through enabling the private sector, you need to really think about regulation, provision. It brings in all of these different policy questions. So I don't know, Joe, that's maybe later on this afternoon, we'll get into that. So really interesting reflections. Thank you, Amy. Thank you, Robert. Thank you, Kondwani.
Well, I just want to say that there was a lot of evidence that we worked with.
Yeah.
So I feel like these are kind of tiny little, like, nice to have additional research questions, but I think the guidelines are based on very good evidence.
Yeah, there we go. Wonderful. I'm going to stop on that point. Really good. Yeah, gaps, but not so many gaps. Right, you guys, you can take your seats, because the next bit we're going to ask all of you to do some work. We're going to put you into, here we go, yeah. We're going to put you into groups. I think, Bethany, maybe 4 groups?
Well, I think actually maybe just 2 even, that's okay.
Two groups, yeah, that's great.
Yeah.
So I'm going to appoint 2 facilitators, and unfortunately, Amy and Robert, you're in my line of vision, and you're on my list.
So we can't be in the same group.
Yeah, and I need to separate you, because I know you'll be arguing about duration of hand washing or theories. So Amy, could you sort of be somewhere over in the left of the room, maybe at the left front, and then Robert back rear, back right, and if you could just maybe just split yourselves sort of diagonally down the middle. into those two groups. We're going to give you about sort of 15, 20 minutes. We'll see how it's going. We'll sort of rotate around, and I think Bethany and Lindsay and Joe are going to drop into the different groups. We've got the following question for you. We'll leave it up there. But what are the priority research investments needed to improve hand hygiene uptake, whether that's by governments, other institutions, or individuals? Okay, so that's the question. And what we're going to request you to do is report back afterwards. So it's usually a good idea in these working groups if you decide at the beginning who's going to do the reporting back, and then that person can sort of prepare themselves through the discussion. But you only need to report back briefly, maybe a minute or two, with sort of three or four key points. Is that clear? Yeah, everyone's already taking notes. Yeah, wait till you get into your groups. So maybe, yeah, Amy and Robert, could you sort of lead the charge?
Yeah. I think we should put chairs.
Yeah.
Circle. Yeah. Are we?
Yeah.
Oh yeah.
I just didn't know if we were gathering around that or we're. No, they have another one too. That's why I was asking you. So, nice. I'm gonna regret this when we go back. Yeah.
Answering the same question. Yeah. Okay, so maybe first, any reflections anyone wants to share before we dive into this? So the question is, what are the priorities that governments need to make to increase hand hygiene uptake? Because that's really the key, right? So you can talk about all the guidelines you want, but what actually is needed to actually make these feasible. I have some ideas, but I'd love to hear everyone's ideas.
Maybe something around financing and cost effectiveness. I remember Becky saying that the financing stuff is quite low on the building blocks, so maybe a bit more around that and
So financing. And then maybe we should discuss like financing as well.
Just the vision.
Anything else?
we don't have trouble with soap availability in urban areas.
I understand from that.
So a lot of areas where a lot of nonprofits are. So I'd love to see something that governments encouraging market solutions for that. Something around that, just like more realistic solutions for increasing soap supply in a meaningful way.
So, and probably hand sanitizer.
Yeah.
I think in general, any money that is any like resources or anything that's spent and or prioritized elevates hand hygiene in general. So I think it doesn't matter if it's coming from an academic institution or the government or anyone. Anytime that there is a study and then or something that's some type of research that's being done. So I know that's not like a specific piece, but I think in general just the amount of kind of research and effectiveness of, we'll say, current interventions that are being done in a particular locale, I think elevates the importance of hand hygiene overall.
So like implementation of research.
Yeah, but again, I think it doesn't have to be, so it could be on financing, it could be on anything, but just more investment in that elevates that as a priority. So implementation research I do think is important, the effectiveness of what's currently being done in school settings or at markets. I think there's a gap as we saw in the other types of settings, beyond households. And so, what does that look like for common areas for gathering?
I think that's really good. I've worked with.
So like just in general, like more attention and yeah. So hand hygiene stations, what's the question?
It's on the board.
And then maybe related to that,
I thought you were looking at me.
in homes and institutions, I mean, that would go a very long way. Yeah.
I'm from.
Education and awareness, the key component in all. If we educate from the school itself, elementary level, significance of why we have and how we have because some of the practical things that I can mention, when we are washing hands, we are just going over like this. The critical component of the hands are the finger pads. You self-inoculate or you rub your eyes and all of that. I have noticed that some of the organisms are very sticky. For example, exercise carrots. If you're not washing properly, you can recover from the finger pads those eggs. And then you can even washing hand, self-inoculate. So education, awareness in schools is really important, and it has a long way to go because then these kids, they can go home and educate their parents. So, it has a really ripple effect that is very important, that should be instilled in young people's minds, because it will have like intergenerational effect. So, and in terms of timing, experimental and definition work that we have done, I think 20 to 30 seconds is good enough. But again, I will emphasize the properly washed hands. Like you wash.
Yes, and that's what's in the guidelines now, is like
the guidelines.
steps, yeah.
It should be put into practice. The guidelines say that, but do we really practice? Do we really instill? That's the
Like demonstrations.
demonstration. That's right.
Just to add on what you said about maybe students or children being able to take a class, I think we also need to invest in research where we're trying approaches where we integrate the home and the school. That's you don't agree with the whole. Yet there are other one area that you don't do it at home, why should you do it at school? So we should try and find out how it can work. Where we are doing it, but that component is also being linked to home. We are at the moment trying, but I can say it's not a wider thing, and so on the facilities as well, I think we still need to investigate. For context, like we know in that maybe countries, we know that government resources are limited. So whatever solutions we are to look at have to be something which everyone or any institution can afford. So as we are trying that, maybe NGOs or other sectors with their implementation, it's like they're just trying out, okay, we saw this somewhere, we put a handshake facility, they're trying to sometimes, because they are implementing funding at other research institutions, they don't follow the performance. What in the school, you see that the bats are not working. So I think we also need more research on that to help you to say, okay, it's group hand washing facilities. This is what is best. This is the minimum cost, and we feel like maybe if we look at the setting of around, if we look at the side, maybe 50 or this percentage of schools can afford, then we can already say, okay, this should be housing.
Okay, so maybe like specific, more specific hand hygiene infrastructure plans so that they can cost it out and planning can be done to make sure that.
And I think going on different parts of society, what we've found a lot of success in is taking kind of like a social ecological approach to hand hygiene and cleaning. So looking at the different levels of society. So we're talking to the government, we're talking to schools, and also at community and household levels. So really getting all of those parts to create that education and implementation. And so we're talking to teachers, we're setting up wash clubs that have an enabling environment. We talk about the importance of hand hygiene to students. Students go and teach their parents, but also parents and households are taught by our staff, the importance of the practice, how to do this is healthy to schools, different things like that. So you've seen a lot of benefits in using that to instill as a social norm, and that creates it encourages households to keep each other accountable to that. We've seen that come out of all the different communities. Like, you get told if you're not following some of these expectations around wash or
I'm seeing a theme here, like start with schools, make sure students understand the importance of development of practices, but also make sure there's a plan for translating that to other.
Just have a reflection that when I take my local languages and them more, so there's the effectiveness of bacteria to depend on the time to salvation. Are we looking at that?
So, if most soap is pretty similar effectiveness,
There's very specific challenges of how to
pretty
measure
basic
something like
components
that.
and also it's pretty similar in terms of its efficacy at removing bacterial viruses. So I think locally produced soap is great.
Maybe we can also have the risk of passing from one list to another, from microbiological risk to biological risk, or chemical contamination. You can give chemical risk.
Yeah. So I was actually in a workshop last month in the United States because there's a lot of debate right now about banning additional antimicrobial compounds from consumer hand hygiene products that are used in homes. And these guidelines actually came up because the industry is saying, well, the guidelines are to wash your hands for like a certain number of seconds, and so like our compounds, nobody actually does that, so our compounds like are important because we can like speed up the disinfection effort. But I was able to stand up and say, well, actually, I don't say that anymore. It's about actually doing a good job, as you were saying, with the hand washing process. And I think that that's really what's most important. But yeah, so like messaging that plain soap is very, very effective. Is that maybe what you're trying to say? Like, I think there's also like a lot of problems around marketing because a lot of companies will market soap products as being like even more effective because they have these added compounds, but actually they're not needed. They're not needed. So maybe like regulations for soaps in countries. Okay.
I was going to say, like, I think one of the things about the guidelines kind of answers a little bit of that question. So, but I don't know if this is for the next session this afternoon. But sorry, just all this stuff on specific behavioral research and, you know, kind of materials and all this sort of stuff. Like, I'm just wondering about the big picture about implementing the guidelines and trying to understand to what it's like, what are the factors that governments may, you know, just trying to basically understand how to, let's say, centrally plan and coordinate separate scale level at the national level. But I feel like that should be done, so I just be remiss not to sort of say it'd be great to sort of follow and understand how these guidelines are received, you know, what we need to correct as far as engaging, and I know we're not getting stuff to do, but I think that's research.
So like research around the process of operationalizing
Yeah,
these guidelines.
yeah, like why is our government using them? Why not? Why? You know, are there aspects within the guidelines that may be better received? Especially all the stuff around, you know, the institutions and coordination, that kind of messy stuff. It's like essentially getting into, like, you know, we talk about hand hygiene systems, right? Like, what is, how do we create that?
2 minute warning. 2 minutes. Just following on that, I think there is national plans processes, and so assessment maybe of where the guidelines support national and be integrated into national planning processes. That's like the effect of the system at this level, I think, in the country. And there's different, but let's say there are different levels. Some is every 5 years, some is every 3 years, but that ends up trickling down, right? Examples from Malawi, right? There's national planning processes that take place, and so I think some assessment around it follows that. I think also what can be learned from successful scale. So like Fit for Schools is a successful scale model, but hasn't been translated necessarily to lots of other countries. So what worked and what didn't work for getting basically hand washing institutionalized in every school across the Philippines, right? But that's only one country. So what are some things that we learn from the few examples of scale around hand washing, which I think are a few and far between for that.
Yeah, I also think like a lot of this was about like changing social norms and messaging, but if the facilities aren't there with soapy water, like, it's not going to happen. And so, how can governments make that happen? There needs to be investment in private water supplies and taps and things, but if that's really not possible, then like, as you were saying, too much costing out how to put in effective hand washing stations and also how to keep them filled with stupid water.
Just to hit that your point, Mel, the whole issue of hand hygiene is not a sort of program that should be implemented by
Maybe because you were a white way. He's like, I've never thought about that, but maybe.
about like water supply, everything, and linking into processes that are already there.
Okay, we're going to come back. We're going to come back together. So if you could finish scribbling and prepare yourself to report back.
We could do a joint share.
Yeah.
Four, you said, or?
I think I said maximum 3, but yeah. You're enjoying being in your groups, or you could, I don't know if you want to stay in the groups or come back. How would, come back, please come back to us. Yeah, feels a bit confrontational with the 2 teams.
It's not competitive.
Yes, sunshine. I think this one, we can put it over here.
Right, just just so you know what we're going to do in the next
You have to pay more.
12 minutes. We're going to report back. The team, by the team, I'm basically talking about Joanna, the World Health Organization, Bethany, Emory University and Evidence Synthesizer, and Lindsay, UNICEF. So this is the team, the crack team. They all are going to listen very carefully to what you feedback now. And in particular, Lindsay's going to give us a few closing remarks and talk a little bit about the impact phase of the guidelines and maybe how some of this will be sort of taken forward. So I'm going to ask the group that was sort of Robert's group. I'm not sure who the rapporteur was. Could you introduce yourself?
Hi everyone, I'm Emily of the school. I work with Emory University.
Emily, I'm going to give you the mic for the online folks.
I don't know if it does, but
It's on. Yep. It's on. There you go. Thank you.
Yes, Emily of the school. I work with Emory University. I'll speak about what my group discussed. So we looked at a few aspects in terms of priorities and motivation, and I want to speak about 3. So we talked about improving or increasing access to water, improving access to soap. And so talking about access, we talked about wash business groups, thinking about wash business centers, for example, where hand washing products can be available and then people are able to access these at ease in communities. And then we talked about the role that the government plays in terms of enhancing hand washing communication, as well as creating awareness about hand washing. We also talked about the role of other community sectors, for instance, like community groups, community leaders, and how they can enhance communication or information about hand washing. And then finally we talked about how we can shift norms about hand washing, and specifically focusing on the do not harm aspect of it. Like how do we ensure that hand washing messages or hand washing information that goes out there do not cause harm to communities. And we gave an example of the COVID washing campaign, how that really worked until the end of COVID, then things went down. So how do we sustain such communication so that the practice is sustained rather than dropped off immediately at an event happens?
Hi, I'm Ellen Walter, representing, I guess, IRC here? Sure, yeah. So, our group talked about a variety of things, and I'm going to talk about some of the things that were different than what the last group talked about, because we talked about a lot of similar things. We talked a little bit about financing and cost effectiveness. One of the big things we talked about that follows on to the government component was around the integration into planning, operational research coordination, specifically related to the guidelines. So what is it going to take for the adoption of the guidelines? And what can you learn from other countries where maybe there has been some scale that we've seen? And then we also talked about soap availability, so like market solutions, affordability, realistic solutions that could be in place. And I think that aligns with kind of the operationalization, but more at a localized level. And then the last thing that I'll say is just around the implementation of the research that's already been done. So as a means to raise awareness. So like taking any research, so all of these different aspects is a way to elevate the importance of hand hygiene and hand washing behaviors and all of that across the board. So I'll leave it there. Anybody want it?
In 60 seconds, I just want to check if there aren't any really important points that you've been sitting on, or you mentioned discussions that you feel weren't captured and you want the team to hear. Great, that means we ran this process perfectly. Okay, so before I hand to Lindsay, I just want to say on cost effectiveness. There's another systematic review which has just been pre-printed. It was a little bit behind schedule, so did it get quoted in the end, Joe, cited in the guide? No, it's too late, that's the problem. I can't remember which university was in charge of that. The London School or something. Anyway, this systematic review has been pre-printed, so if you are interested in cost-effectiveness studies and also cost-benefit studies around hand hygiene, it's under review at WHO Bulletin, but it is available as a preprint. So that is an area where we did the evidence retrieval and synthesis, but just to confirm your call, there's not a great deal out there. Yeah. So Lindsay, I'm going to ask you to speak. If you could do two things, at least two things, could you just explain a little bit why you decided to get involved in this 4-year process to arrive at guidelines of the WHO? So from an institutional perspective, why you felt that was useful. And then what comes after the guidelines from a UNICEF perspective, because you are, I think, one of, if not the biggest sort of WASH operational UN agency.
Sure, great. Good morning, all. And I'm speaking on behalf of UNICEF, but I'm speaking on behalf of a number of individuals who've been involved in the hand hygiene work over the years. Most importantly, Ann Thomas, who unfortunately couldn't be here. She was here earlier in the week, Senior Advisor on Sanitation and Hygiene. So, of course, we all lived through COVID. And of course, UNICEF was a key partner in ensuring that people had access to hand washing during the outbreak. And so, engaging with WHO during the Hand Hygiene for All initiative and recognizing, again, that there were the lack of the guidelines that Joe presented earlier, etc., and realizing how critical that was in response to what our member states were saying that they needed this support. Anne would tell a story about being in Indonesia and trying to support the governments with questions on businesses and marketplaces, etc., and feeling ill-equipped to do that. So it was really critical that we joined WHO as part of this effort. Certainly you all have the WHO guidelines process, and we follow that to a T. And so really, grateful to Emory for the work on the research and to WHO for guiding that process and really just bringing in our implementation perspective of how we would take these guidelines and utilize them down the road. So conversations on ASH and what that meant and these sorts of things. So for us, I think some of the questions you all asked are really critical. I think hearing questions on the role of government and engaging them in enhancing awareness. How do we sustain these behaviors? Cost effectiveness and financing, these are all critical questions. But I think at the same time, at least from UNICEF's perspective, we know we can't wait to answer those questions to start acting. And so if you come to the session this afternoon, you'll hear about what's actually in these guidelines. I feel like we're teasing you. It will apply all the things we heard from the systematic reviews. And from UNICEF's perspective, it's really now the time to take that and start working with governments to start implementing these and taking action to ensure that people do have access to soap and water, that they can perform these behaviors, while also working to start understanding these questions better. What does it take to sustain behaviors? Research funding, as Ollie and I were just saying, is not out there as strongly as it once was. So being able to figure out how to answer these questions perhaps in a different way than the ways we used to approach this, but lots of gaps to address there. But we need to get the work underway. We can't just wait. So I'll leave it there, and I believe, Ollie, we're handing it over to the last speaker.
Slides are great now. So, our final speaker and slide. Sarah Roberts, who is the Executive Director of the Reckitt Global Hygiene Institute. And I guess RGHI sort of came into existence in the same sort of timeline, last 3 or 4 years.
It's 5 years old now.
Okay, great. Well, happy birthday.
Thank you.
We can hand over to you to close, please.
Apologies everybody if these ideas aren't quite fully formed. I appear to have contracted some lurgy, and believe you me, the irony, considering my role of picking up something at a conference, isn't lost on me. But yeah, I just want to say, congratulations to everyone involved. I mean, this is an absolutely fantastic milestone and achievement, isn't it? And I'm fully aware that they're the product of sort of deep technical expertise across many institutions, and I think just really reaffirm that hygiene is not just a matter of personal behaviour, but really a system-wide investment in health, dignity and resilience. And I think that as we celebrate that progress, as this session has indeed outlined, it's important to acknowledge that those gaps do remain, because I think identifying where the evidence is thin isn't a limitation of the process, but actually what helps really keep it alive. It's what helps us improve, adapt and remain relevant in a really rapidly changing world. So understanding those gaps is what allows us also to move from aspiration to application. It tells us where to focus our next phase of research and funding. To your point, it's limited, so I think that focus is incredibly important. But I also think it's important that that doesn't happen in isolation, but in dialogue with policymakers and practitioners, and that early engagement really, really matters. And RGHI, this approach really underpins much of our work, supporting research that doesn't stop at discovery but continues through to translation and uptake as well. So it's about ensuring that good evidence becomes good policy, and that those policies are really grounded in local realities. Because I think, as the panel mentioned earlier, without evidence, we do perhaps risk acting on assumptions. But similarly, without action, there's no opportunity to impact. So I think I'm really keen that these are seen as a roadmap, and I'm really keen to explore the role that potentially RGHI could play in supporting that further. So yeah, congratulations to everyone involved, and thank you for having me.
It's 10 o'clock on the dot. Yeah, thanks everyone. Brilliant session. Thanks again, WHO, Emory, and UNICEF. And we'll see you all at 1:30 in which room?
Here we are.
Oh, right here. There we go. Couldn't be easier. Yeah. Okay. Have a nice coffee break.
Just don't leave.
Thank you.
Good job, guys.
I have like 17 questions for you, but we'll chat later. I can answer some of the others.
Yeah, well, I was thinking of something really interesting. I have questions on that.
It was great, and I like that. You have good animations. Maybe animation is the wrong word, but it's just like this one function. Yeah, of course. I love it. I like when I know that function, because I never done it.